Uh, when I started working in the Green Circle Health, we created this company 3 years ago. And the first thing I learned as I was looking at the long history that we talked about here today was that everything we did with the EHR system up to I came around was completely wrong. Second thing I discovered that only I can fix it for all of you. And the third thing was that for next 15 minutes, I'm going to show you how that is done using all the alternate facts I have collected for this time. And finally, if you get to voting for us today, make sure you vote Green Circle Health as the number one. And those of you who do not vote number one will get a tweet from me at 6 o'clock in the morning. So having said that, let's begin by looking at the team that is behind Green Circle Health. We have a seasoned team. This is my 5th startup, so we have been at this a few times before. This is the first one for me in a healthcare space, so that is new. So we assembled a team of very good legal counsel, a pediatric cardiologist who is best in his field, and a chief technology officer who has worked with me for past 20 years in 4 of our 5 companies. And we are on a path to profitable growth today, and I'll explain what we do. So the focus of Green Circle Health is how we help millions of people live a healthier, productive life, and by doing that, eliminate billions of dollars in the cost. When we started working on this and when we got invitation to come here, that is a result of our work with ONC. So last year, ONC announced a challenge to take the health data for consumer, the patient, the families, and make it usable for them. So after $30 billion that we have invested in a digital EHR and numerous portals that are built for patient portal, the data was locked up where really if you as a consumer try accessing that, it is difficult to get. And so that challenge required us to build a platform that would allow us to get the data from EHR and make it useful to consumer. So I'm going to spend most of this presentation talking about what we did there, then our entire business model. Along the way, we went to a few competitions and we got ourselves recognized for the work we did in this space. So what was the data aggregation challenge that required FHIR integration? As you just heard in the last presentation, the challenge for those type of application is common, that the data that resides in EHR is very difficult for consumer to work. So our idea is that how do we take the data out of EHR, bring it into the consumer hand, but the data is not valuable, consumer doesn't want to use it, because we as a consumer of health data have never used health data for any productive purpose. Now when I talk about we, I'm not talking about the clinical side of the equation, which lives, buys, and knows everything about that data. But when the data is brought to the families, families have very limited knowledge of what to do with that data. So we worked with a number of EHR vendors as a part of the challenge to free up that data and bring it to home. And there we found that really there is a responsible adult in the family, we like to call her Dr. Mom, who looks after the health of herself, her husband, children, parents, in-laws. And all the data historically resided in her magical purse, where if anybody has an appointment or any question about immunization, typically she would have the answer. So we built a tool that made it easy for her to take this data and use it for ongoing basis. So if the audio works, I'm going to walk you through the FHIR integration first, and time permitting, I'll show you a few more things.
Welcome to Green Circle Health. We are delighted to take part in the Consumer Health Data Aggregator Challenge to demonstrate how we enhance the consumer experience in managing their health and well-being. GCH is the next-generation collaboration platform to aggregate your family health records from multiple sources, like hospitals, clinics, and healthcare providers. GCH exchanges health data with EHR systems that are integrated with the platform using FHIR interfaces. You can combine health records aggregated from various health systems with data stored in GCH. You may also augment such health records with vitals and activities from personal health devices and activity trackers. Let's see how GCH integrates with various EHR systems to aggregate medical records. All the healthcare systems that are already integrated with GCH are listed here. A summary of the data synced from the system is also shown. You can see consolidated records from all healthcare providers or filter the records based on a specific provider. As you can see, we have already added Northwest Hospital with its Epic EHR system, and data is imported. To integrate a new provider, click on the Add New Healthcare Provider. Choose your healthcare provider from the list. Today, GCH supports EHR platforms from Epic, Cerner, Allscripts, and Smart Health IT. Enter the details required to identify your data in that system, such as medical record number or MRN. Now validate whether you are the rightful owner of the data. 3 questions are asked using the data from the provider. After verification, click the Sync with Healthcare Provider button. All the medical records synced from the EHR are categorized and displayed. Some of the categories are allergy intolerance, encounters, and immunizations. These records can be imported into GCH by clicking on the Merge with GCH button. Choose the records by clicking on the checkboxes. Choose Immunization Records to merge with GCH Immunization Records. Choose Merge to transfer your records. The merge records are highlighted. Now let's repeat that process for 2 other systems. First, we add North Illinois Hospital with Allscripts EHR platform following the same steps as before, and we will merge immunization records from that system. Next, we repeat the process with DuPage County Hospital with the Smart Health IT interface. Here we will import the medication data from this system to GCH. Now let's view the GCH health record for immunization and medication. The merged immunizations records from various systems will show in the completed immunizations list, and the medications records will show in the medications list in the GCH records, as shown here. As you see, health data from many health systems can be imported in this platform. Today we interface using FHIR to all 3 major systems available for testing in the ONC lists. We also have added Smart Health IT via FHIR to bring the information from other sources. This is the consumer dashboard to manage health and well-being. GCH care programs can be used to monitor and manage various chronic disease conditions like diabetes, hypertension, heart conditions, asthma, as well as fitness. Care programs give you an overall status using various vitals and answers to your condition-specific questions. You get alerts and reminders to follow your care protocol and messaging to coordinate care. GCH has an extensive library of articles and coaching literature. Health data can be securely and efficiently shared with healthcare providers and caregivers. GCH offers comprehensive sets of services to enable care providers to receive and use consumer-aggregated health data. GCH improves collaboration among care providers and consumers, resulting in better outcomes and lower costs. GCH is focused on giving the control of health data to where it belongs, individuals and families. GCH is on a mission to change the paradigm of healthcare by improving outcomes while reducing the cost.
So what you just noticed here is that it is a complete platform, what we like to call it is a family EHR for 98% of your life when you are not in a hospital, when you are not in a clinic, but you are at home taking care of your health and well-being. So it's a change in a paradigm where we are not only allowing individual to do it, but we are also managing entire family's data from one individual, fully compliant with the requirement of the laws. We offer this platform also bringing two other sides together, where typically when you look at employer-provided programs, wellness is in one silos, and then disease management, condition management, care coordination is in a separate silo. Or you wind up with a separate app for diabetes, separate app for blood pressure. Here you have a single platform that is going to give you all the apps you need for entire life, from prenatal care to geriatric care for every family member. You get a single platform that you would use once. You populate that either manually or through connected devices and connected EHR, and that platform is good for you. We have been at this for 3 years, building this comprehensive solution. We take it to the market through employer, so that at Duke, if we want to offer it to all the people, all the students, all the faculty, that is the market where we offer it to make you healthy. Our business has been, the part of the ONC challenge was not only to build the FHIR interface, but also to demonstrate that a viable business can be built around consumer aggregated data. So today we are pleased to let you know that we have launched this service after 2.5 years of work. It went live last fall. We have an insurer with 500,000 people using it. We have an employer with 80,000 employees in all 50 states using it. And we have a clinical support center that we support all the care management for these people. So we are on a path of a profitable growth. And thank you for your time. If you want to see more, come back at the lunchtime. Thank you.